I am here on behalf of Medico Legal Society of India, which is a national level non-profit organization of medico legal experts established on 24th August 2022 with object of providing legal assistance to the needy medical professionals, making aware and educating medical professionals about various laws related to medical profession, studying, analyzing, doing research, suggesting changes in legislation affecting medical professionals. Along with this, our main intention is filing intervention application, writ petitions and PIL review petitions before various high courts and supreme courts in the matters affecting medical professionals or patients or both. The topic of my today's talk is updates related to medical field in BNS 2023. So in this lecture, I will try to understand you that law is not so difficult and it is easier than the medical practice. So everyone knows that from the 1st July 2024, the Indian Penal Code means IPC get replaced by the Bharatiya Nyaya Samhita. Code of Criminal Procedure get replaced by the Bharatiya Nagrik Suraksha Samhita. Indian Evidence Act get replaced by the Bharatiya Sakshya Adhiniyam. So all these together are called as criminal law. So these laws are applicable to every citizen of India, wherever it may be, or any citizen of any country who is in the territory of India, along with any ship, vessel or aeroplane registered in the India, wherever it may be. But there are some categories of person who are immune from the prosecution under criminal laws and at present, and the categories of these persons are the president of the country, governors of the state, foreign sovereigns means head of the foreign countries, foreign diplomats means ambassadors, means which are considered as the agent of that foreign sovereign or the head of the foreign country. So doctors are not included in this list, means these criminal laws are applicable to the doctors also. So this is a old thing now. Everyone knows that the section 304 in the IPC was for causing death due to negligence, and now it is replaced by the section 106 of the BNS. So for realizing the details of this section, we will compare these sections in a chart. This is an image of circular issued by the Medico Legal Society of India on 1st July 2024, means within 10 days of passing the laws by Parliament and within 7 days after publishing the law in the official gazette. So here everyone knows that the punishment is kept same, but the imprisonment is made mandatory. So apart from this, there is one thing which new thing which many of us don't know. I want to tell you that these offences are non-compoundable. Non-compoundable means in this offence, out of court settlement is not allowed. For doing out of settlement, we have to take the permission of the sessions court. This is the most important thing. If we suppose in any situation, if we pay the money to the patient for not filing a police case, it is illegal. Though you take it in writing or a notary or any bond paper, it has no value in the court. So whenever you do this, the only thing you can save is the trust, mutual trust between you and the patient and the mediator or the third person who is doing this deal. Now, one more thing, for medical negligence, can offence be registered under the sections other than the sections 106 subsection 1 of the BNS 2023? The answer is yes. It may be registered. It is not necessary that the offence will be registered only under the section 10 subsection 1. Though that FIR may be result in quashing or may be acquittal during the trial, some of these sections are section 10 subsection 1 is for murder, which is a cognizable, non-bailable offence triable by the court of session. Cognizable offence means such offence where a police officer can register FIR without the order of the court. And non-bailable offence means where accused cannot claim bail as is a matter of right. And triable by court of session means the trial or for the bail we have to apply for the court of session. Similarly, second is offence of culpable homicide, which is prescribed under section 105 of the BNS, which is also cognizable, non-bailable offence and triable by the court of session. So see, section 106 is also means from the family of the section 103 and 105. we can say that these are offenses against the body and related to the death of the victim or the person. So these are from the same family, and in this section you can see that suppose we think that murder is a most senior brother or eldest brother, where culpable homicide is younger than it, and death due to negligence is a youngest brother, because it is bailable section, again cognizable section, but bailable and triable by magistrate, whereas culpable homicide is a cognizable non-bailable section and triable by the court of session. And in this section, in the two sections, murder and culpable homicide, court doesn't grant the bail before the submission of the charge sheet. So if there are the many instances where you say that the court doesn't grant the bail, then we think that doctor must be guilty, hence court is not granting the bail. So the situation is not like that, because according to the criminal law, the court cannot grant bail before the submission of the charge sheet. But if offence is registered under death due to negligence, then it is a bailable offence. Other sections are grievous hurt, which is a cognizable offence but bailable offence. Means in this case, though FIR is registered, accused can claim bail as is a matter of right, and it is triable by magistrate. Whenever offence is triable by magistrate, it is less serious, and when it is triable by the court of session, it is serious offence. This is one more subsection introduced in the section of grievous hurt. We can say that it is a new member in this family. It is a section 117 subsection 3, which is grievous hurt resulting in permanent disability or vegetative state. It is issue of concern for us medical professionals. This is a cognizable offence, non-bailable offence, and triable by the court of sessions. So there are some instances where patient can claim that if there is a hypoxic brain damage, so the patient can claim that it is due to the delay in the resuscitation, and the offence can be registered under this section. There are some more sections which are also present in the sections which I have written in the red are new sections, and the sections which are in the black are old sections which are already present in the IPC. This is a negligent act likely to spread life-threatening infection, which is a cognizable and bailable offence triable by magistrate, means it is not serious. Malignant act likely to spread life-threatening infection, which is the cognizable and bailable offence triable by magistrate, which is also not serious. So these two offences are very widely registered during the period of COVID against so many persons other than the doctors also. Again, the section, this is a section 316 subsection 2, which is for criminal breach of trust, which is a cognizable but non-bailable offence but triable by the magistrate, means less serious than the offence of murder and culpable homicide. Again, this is a section of cheating, which there are some cases where this is also imposed against the medical practitioner. I mean, in the situation that the doctor is not suppose a specialist in that field, and he pretended that he is a specialist and treated, due to which these sections were imposed. But in the IPC, it was section 420, which was non-bailable. But now the definition of the offence has changed, and it is means distributed into various subsections, and under which the cheating now is a non-cognizable but bailable offence. Which in non-cognizable means now the FIR will not be registered in this case without the order of the court. So whenever there is an offence is cognizable, nothing to worry, police officer will not register the FIR. So there are some prerequisites for registration of the FIR in cases of medical negligence. All of us now know that there are the guidelines prescribed by the Jacob Meth in the state of Punjab case regarding the mandatory expert committee opinion. But this opinion is not binding on the police. Police officer, in spite of getting an opinion in favor of doctor, can register the FIR with when police officer feels that there are the sufficient reason to do that. And it is upon discretion of the police whether to and under which section FIR should be registered. Means though FIR is against the doctor, but whether to register FIR under the section of murder or culpable homicide or death due to negligence, it is upon the discretion of the police. And Public Health Department of Maharashtra government has issued 2 circulars in the furtherance of this judgment. One is in 2010 and another is 2014, which is related to the constitution of the expert committee. Second case is Lalita Kumari versus State of Punjab, in which Supreme Court prescribed that there should be a time-bound 7 days preliminary inquiry in the cases of medical negligence. National Medical Commission in the year 2021 issued 1 notification in furtherance of this judgment. Now what we can do for if police doesn't follow these guidelines or doesn't do that or doesn't send the matter to the expert committee, for violation of these guidelines, police officer can be tried under the section 198 of the BNS. But this is a non-cognizable section, means FIR will not be registered against the police. We have to approach the court, and for such trial, permission of the government is required under section 218 of the BNSS. And government will never give the permission to prosecute its employee. So actually it is useless. There is one more section about which too many people are worried, that there is one section in the BNSS, Bharatiya Nagrik Suraksha Samhita, in which it is, which is section 397, in which it is prescribed that there should be a mandatory, any hospital, means maybe government or maybe private, it doesn't matter. It is mandatory to give first aid and inform the police for the, if any victim of the rape or acid attack or the offender and offense under the POCSO Act comes to that hospital. And for violation of this provision, there is a punishment in the section 200 of the BNS, which is imprisonment up to 1 year or fine or both. But this is a non-cognizable offense. Police officer cannot register FIR without the order of court, which is bailable and triable by the magistrate. Means we don't have to worry about it. So is everything bad for us in the BNS or in the IPC? So no, there are good things are also. These are called as the general exceptions. So these are prescribed from the section 14 to 44 of the BNS. These were also present in the IPC and under the section 76 to 106. So these can be used for defending our allegation of medical negligence. So basically, what is the concept of general exceptions? So according to the criminal law, for the constitution of the offense, two elements are required. One is called as the mens rea and the second is the actus reus. Mens rea means the intention to commit an offense, and second is the action in furtherance of that intention of commission of offense. So what is general exceptions? General exceptions is the offense minus intention, means there is a commission of, there is action of commission of offense, but there is no intention to commit that offense, which is called as the general exception. So some of these general exceptions which I feel that can be used in the defending the allegation of medical negligence, I will explain it, but I request everyone to please go through this all sections, so it can be used in your day-to-day, not only but practice, but in day-to-day life also. So there is a section 18 which is about accident in doing lawful act. Under this act, there is a scope for recognition of concept of medical accident, which is not recognized till now. The accident in doing lawful act can be, means example can be given that any drug reaction, and if you can prove that you have taken every care to avoid that reaction, means doing test dose, etc., taking the history about any allergy, and you have done everything to prevent the damage to that accident, like treatment for that reaction, you can claim this general defense. Again, there is a section 19 which is act likely to cause harm but done without criminal intent to prevent other harm. Means just like suppose you are doing any amputation to prevent the spread of the gangrene. So you can take, so it comes under this defense. In the absence of this defense, what will happen? As you are doing amputation, means you are creating the permanent disability in that patient. So you can be tried under the section 117 subsection 3 of the BNS. So these general exceptions are very useful, and we should know that. There is a section 25 which is act not intended and not known to be likely to cause death or grievous hurt done by consent. So any treatment given by taking proper consent comes under this exception. So why consent is necessary? The legal recognition to the concept comes from this section. There is one section 26, act not to cause death done in good faith for person's benefit. So this example is quoted in that in the BNS also, which I have written here. Surgery likely to cause death done by a surgeon with an intention not to cause death but to cure the disease. There is section 30 which is act done in good faith for a person's benefit without consent. So the in emergency consent is not required. There are so many decisions and everyone knows that in emergency consent is not required. But from where this concept is originated, so this concept is originated from the section 30 of the BNS. Now section 31 is communication made in good faith. So like that death of any patient due to shock or suicide in furtherance of the communication made by doctor that he is suffering from life-threatening disease like HIV or cancer. So if such situation happens and the relatives of the patient files the case against doctor for abatement of the suicide, so doctor should take the this defense. So this is a definition of consent. It is prescribed under section 28 of the BNS. The one definition is also in the section 11 to 22 of the Contract Act. So I will not go into detail because already there was a dedicated lecture on it. So now what can we do against the patient for the violence? So if, as everyone knows that there is section 4 of the Violence Prevention of Violence Against Doctors Act 2010 of the Maharashtra, but important thing is that in section 2 of subsection I, in the definition of the violence, intimidation is included. मीन्स क्रिमिनल इंटिमिडेशन, धमकी देणे हे पण एक व्हायलन्सचा प्रकार म्हणून त्यात टाकलेला आहे. म्हणजे असं आवश्यक नाही की मारहाणच झाली पाहिजे, तोडफोडच झाली पाहिजे. Intimidation is also included, and intimidation is if the offense is registered under this section, then it will become a cognizable, non-bailable and triable by the magistrate offense. Against some other sections of the IPC which can be used against a patient for the violence are attempt to commit murder, which is a cognizable, non-bailable offense, triable by the session. In this, again, attempt to commit culpable homicide, which is also cognizable, non-bailable offense, triable by the session. So in both these two offenses, session court doesn't grant bail till the submission of the charge sheet, just like case of murder and culpable homicide. These are serious sections. If in case of any violence, if these sections are imposed on the patient, then that accused patient or patient's relative who commits the violence, it is very difficult to get that patient bail till up to 90 days. Again, section 117 subsection 2 previous hurt, which is a cognizable and bailable offense, triable by the court of magistrate. There is one more section which is of extortion, which is very important. There are many incidences where there is a death due to negligence and patient demand for the money, and we feel that it is their right because there is a death of patient, but it is not like that. If they demand for the money, it is the offense of extortion, which is a cognizable, non-bailable offense, triable by the court of magistrate. Again, criminal intimidation, which is a non-cognizable, bailable offense and triable by the magistrate, means if the offense for intimidation is registered under this act, it will be non-cognizable, means police officer will not register the FIR. But if that section of the section 4 of the Prevention of Violence Act against doctor is imposed, then the accused, the FIR will be registered and it will be non-bailable section. Again, what action we can take against patient for false complaint? Yes, we can take action for false complaint, which is under section 217 of the BNS. It is for giving false information to a public servant without criminal intention with intention to cause that public servant to use his lawful power for injuring another person. Means patient or that relative is giving false information to that police officer who is a public servant so as to cause injury to the doctor. This is a non-cognizable offense, bailable offense, triable by the magistrate, and for which punishment is imprisonment up to 1 year or fine up to 10,000 rupees or both. I end my section here with hope that I am able to deliver some useful information to all. Thank you very much.